Hey guys, and welcome back to another show of Canna Tell You Something. So this week we have Dato Dr Kevin, who is calling us from Australia. He is a medicinal cannabis doctor who is with Cannabis Clinic Australia, who is prescribing medical cannabis for patients over there. And today we're going to get a very lovely insight of what is going on in Australia, and also Dato's point of view of what steps should be taken for cannabis, especially here in Malaysia. So without further ado, I'd like to invite Dato Dr Kevin. Hi Doctor. Hi Dato.
Hi, hello, how are you?
Good. Thank you very much for joining us today for our show.
No problem.
Yes. Okay, so Dato, before we begin, for the viewers at home who have not who doesn't know much about what you do you mind if you can give us a short introduction about yourself and what you do, Dato?
Sure. I am a medical practitioner, medical doctor, based in Melbourne, in Australia. I've been in Australia since 1997, and I went to Melbourne University for my medical degree. I graduated in 2004, so I started practicing medicine in 2005. In the last 1 year, I have been prescribing actively medicinal cannabis for patients based in Australia.
Okay, doctor. So basically, how many years have you been prescribing for medical cannabis, doctor, in Australia?
I started this journey in prescribing medicinal cannabis since basically last June, so about a bit over a year now. Basically, in Australia, medicinal cannabis is legal. It has been legal since October 2016. But at that time, there were not many people who understands or knows about it. A lot of my medical colleagues are not aware about it. It is a regulated medication that will require a special approval from the federal and the state government before we can allow to prescribe that for various certain conditions. In Australia, most of the approvals will have to come from something what we call the Therapeutic Guidelines of Australia, so the short form TGA. So they basically categorize and review the special access approval for people who are patients who are wanting to access medicinal cannabis in Australia for some conditions.
Okay, doctor. So, doctor, in your opinion, how many doctors in Australia were well aware about the endocannabinoid system and the medicinal use of cannabis before it was legalized?
Basically, I would say not a lot. For instance, as comparisons, the tractions in terms of people or medical colleagues of mine that are prescribing it has only increased in the last 1 year. So when they first started in 2016, in October, there were not many people who were aware about it. Not many were prescribed, but I've got some data as well. Just before today, I was looking up some of the therapeutic guidelines of Australia data. So the TGA has three options of how you can access it. One is through an authorized prescriber, that means the particular doctor is authorized to prescribe medicinal cannabis for various conditions. So they don't have to go for any approval because they are already authorized and approved by the TGA to prescribe that. I'm one of them. The other option is through the SASB, which is a special access scheme. So you apply as a per case basis. So you go to the online portal, you put in the patient's conditions, details, and information about why we are looking at prescribing the medicinal cannabis for them and for what purpose and what treatment that we are wanting to use. Now, generally, the TGA will require that patients have tried conventional medication and failed those conventional medications, and it's almost like a last resort that they have nowhere else to turn to, nothing else to use, then they will approve it based on that purpose to try the medicinal cannabis. That's how the SAS special access scheme is done. A lot of the newer doctors will go through this SAS scheme to try to get approval, and then it is something that they are learning at the moment, especially in the last 1 year. We have seen quite a lot of increased amount of GP who are looking, of specialists who are looking at prescribing it for their patients. Before it got legalized, I would say probably not a lot of them, not a lot of us are aware about that. even up to last year, they were, let's say, for instance, in August 2018, there were only 200 over approval in that 1 month for this special access scheme. In August 2019, that has increased to roughly about 2,000 approvals. And now July last month, we had about 5,000 approvals. So it has come up a lot, and a lot of them are due to more exposure. For instance, people like Oliver John, who is a famous, basically a celebrity in Australia, who are using it for her breast cancer treatment. So she has gone up to do some documentaries which were released probably about end of last year. So from then, there were a lot of other celebrities of people who have been talking about them, and that has gained a lot of traction, a lot of interest in a lot of the public to look into accessing this for their various conditions. So at the moment, there are interest, but it is still very limited in terms of numbers of doctors who are aware about them. There are a lot of them who still think it's not legal, or some of them they believe they know it's legal, but going through the paperwork or framework of getting approved to 2 years for that, it's not as special. So they refer to people like us who basically specialize in prescribing. So they refer their patient over to us as assist their patient in getting access.
Okay, Dato, thank you very much. So as you were saying, now there's over 5,000 registered practitioners, right?
So 5,000 approvals from last month.
Approvals from last month. Okay, that's a very huge increase since 2-3 years ago. That's really good improvement. In Malaysia, we are still looking into having more doctors to look into cannabis, because we feel that and another confusion that doctors have here, Dato, if you don't mind sharing with us the situation there, is that over here the doctors are looking more towards pharmaceutical products, which means maybe in the direction of Sativex and Epidiolex. But there's a lot of studies and proof case studies that is showing that by using full spectrum extracts, it is much more efficient, is much more effective in treating many types of medical issues. In your opinion, in Australia, what type of medical cannabis is available in the clinics over there today, and how many patients do you prescribe for? And at the same time, what type of improvements that you may have witnessed, Dato?
Okay, so basically over here, we have Sativex as well. That was the first one that people got approved for multiple sclerosis use. Since then, obviously there are more brands, like international brands from Canada or from Europe or from US brands that are coming in to establish the market here. So over here in Australia, the clinic consult, but we don't actually store medication, or we don't we prescribe the medication, but then the patient has to go to the pharmacy to get the medication dispensed. So that's the model that we have here. It's different to in Malaysia. I know they do have stocks of medications that they prescribe in the same clinic. So over here we have basically there are 2 versions. They are the full spectrum version of all the different brands that are coming in. So they are under the classification of TGA as a non-therapeutic group. So that means that's why you need special access or special approval to access that. Once the approval comes through, with the approval letter, we then prescribe with prescription to the patient. The patient then go and seek the pharmacy to order the medication in from the suppliers. So the suppliers are various brands who are bringing in medicinal cannabis products into it. The other component that they have sometimes is a compounding component, where the Australian pharmacy are able to compound and reconstitute the medicinal cannabis into the compounding product to dispense to the patient as well. That requires approval as well, but there's different pathways. So these are the various basically medicinal cannabis products that we have. Product-wise, we have things like oils, medication oils that we have under the counter. There are some dry flowers as well that some doctors do prescribe, and some brands do carry them as well. These are the 2 main products that is available. We don't have an extensive in terms of product range compared to Canada or US, where they have balms or basically cream that you can apply, or even a wheat oil. We don't have that here. We are at the moment limited to just basically
so from your experience, Dato, like I mean, of course, TJA allows for patients who have no other option to receive medical cannabis treatment. So from your experience, Dato, I mean, out of the 1 over years that you've been prescribing medicinal cannabis, what types of patients that approaches you? I mean, what type of patients do you meet, and what type of feedback do you get from them from using medicinal cannabis?
So our most common conditions are either cancer-related pain or chemotherapy-induced nausea or vomiting. We also have the non-cancer-related pain, so things like osteoarthritis or fibromyalgia or multiple sclerosis or certain types of chronic pain. These are the two most common conditions, and then followed by that we have anxiety, depression. We have patients who are passing patients who have had epilepsy. They are coming to use it as well. We have patients who have Parkinson's or Alzheimer dementia. We also have patients who are using it basically to help them with basically improving the appetite as well, especially for those who are in sort of a palliative cancer stage. So the appetites are not there. So by using the medicinal cannabis, stimulate the appetite. And definitely inflammatory bowel diseases like ulcerative colitis, inflammatory bowels, and Crohn's disease. We have been using that a lot as well for this patient.
Yes, Dato. Actually, there's a lot of research proving that medicinal cannabis is effective for Crohn's disease, Alzheimer's. There's research being done in Malaysia on lab rats in University Putra, Malaysia, which proves that TAC is very effective for treating depression, treating Alzheimer's and all these brain neurological related diseases, right? So we feel that TAC is something that should be looked into in Malaysia. And as an organization, MASA, we are proposing for a research study, a clinical trial, to better understand what TAC does to the mind and body. So one big stigma that they have here is that TAC causes you to become intoxicated and you can't carry out your daily jobs, and you won't be able to function as a normal person. So this fears and stigma has been clouding a lot of people, a lot of minds in Malaysia. But from your opinion, doctor, I mean, you have prescribed medicinal cannabis for many patients in Australia. Have you seen any types of negative side effects from using TAC products and so on?
Basically, in Australia, we have two components. Obviously, you've got the CBD, which is the non-psychoactive components, and then you have the oil that has a combination of CBD and THC, which is THC is obviously the psychoactive component of the cannabis plant. Now, the cannabis plant has over 400, 500 different properties, but at the moment, we are focusing on basically either the CBD or the THC component. The other components are still being researched and still being studied, so we don't have that to use at the moment. But there are a lot of different functions and benefits of the cannabis plant as whole. So in terms of the stigma, there are still obviously stigma about that marijuana or cannabis will cause hallucinations, psychosis, and things like that, because that has been associated with the use of recreational drug use in the past, which is the same in Australia. For instance, the older populations who in the 70s or 80s, they still have that stigma because growing up in the era that that drug is illegal, things like that. So they have this thinking that anything with THC is bad. But it really just boils down to the condition that they're using it for. I normally start patients on a pure CBD oil unless they have been using it, and then I will look into going straight to the CBD and the THC combination, or the THC combination. So it depends on what the conditions they're looking at. For instance, epilepsy, we will only use the CBD. We will not use anything with THC. For instance, insomnia or anxiety. Sometimes, yes, some people do require a bit of THC to help them to sleep better at night. Now, in terms of the psychosis effect, the formulation itself, it is very low in the amount of THC to be able to cause any effects of psychosis or effects of hallucinations or any effects of overdose. it is very unlikely that they will cause any of that because of the dosage that is in the formulation. That's if you think about having approval from a formulated brand that already has this testing required by the therapeutic guidelines Australia, so that we know coming from a doctor who's prescribing it, we can then titrate it, we can observe any of these so-called side effects if there is any. And it's better than patient accessing it illegally through the black market, because then you do not know what's in there, you do not know what's component in there. There may be impurities as well. So it's not very well regulated, and then nobody knows if there's anything that would any potential side effects, nasty side effects that can be caused from that. We cannot monitor. Whereas if we are prescribing it and monitoring it to a proper pathways, proper regular checkup and consultation and titration as well, then at least we know if there is any potential side effect of that, we can mitigate that and reduce that occurrence. Side effects wise, I guess it pretty much depends on individual as well. Different people basically metabolize the component differently. So the dose titration for every individual is different. You can have two identical twins, but they can have different doses that work therapeutic for them. So we normally always go by the standard of going slow and going low. So we start with a low amount, go slowly, increasing it over time every 3 to 5 days, and then titrating it upwards to try to find that therapeutic window that works for the patient. So we normally, I always advocate this for my patients that we start slowly, we increase it over time, and then we have regular conversations to see how the medications are working. If sometimes it comes back to finding the right combination, whether it's a CBD or CBD THC with various ratios, that 1 to 20, 1 to 2 ratios, 1 to 1 ratio. So there are a lot of different ratios there that we can try. It is the tricky part is about finding the right combination, and from that combination the right fit that actually works for that patient. A lot of patients sometimes get very confused because it is not the same as when you go to this take this medication, take 1 tablet, 2 tablets, to a certain milligram that is fixed. Medicinal cannabis is fluid in a way that you actually adjust it according to your body's requirement and what works best for you. I normally see about 120 to 150 patients per week for medicinal cannabis. So probably one of the more experienced one over here in Australia prescribing this amount over the last 1 year. So I'll sort of be up to that level.
Okay, Dato, thank you very much. Actually, 150 patients a week is quite a huge number of patients. And one thing I think I've shared with you before, Dato, there's a patient here in Malaysia. Her name is Ira Ixora. She's a 2-year-old girl with cavernoma tumor, in the brain, which is very difficult to be operated out, and it's difficult to help her at such a young age. She was diagnosed with cavernoma tumor when she was only about 1 year and a half. So her parents, her father especially, was very worried for her condition, because the doctors were informing them that his daughter's condition is very serious and she might it might be fatal. So the doctors advised them to be strong and to anticipate for anything that might happen. And that was when the father of Ira met a friend of his, which recommended medicinal cannabis, because there's so much research all over the world. There's so many countries who's using it for tumor related cases. So he took a chance. He bought the cannabis oil illegally from the market in Malaysia, which is it is said to contain 1-to-1 ratio. But as you said earlier, it is not regulated. It's coming from a black market. We can't really determine what's inside of it, or whether it's good quality. But at the moment, when Thailand and India and many countries are opening up for medicinal cannabis, the products that are coming into Malaysia are also getting better, because there's more attention paid to it. There's more demand for it. So the quality of products is coming in, even though it's from the black market, is getting better compared to what it was a few years ago. So he was treating his daughter for about 3 months in his village using the cannabis oil, and the tumor shrunk. It shrinked, and she was able to laugh, she was able to run, and when she went back to hospital KL, Kuala Lumpur, HKL, the doctors were amazed by her improvement. But of course, the father did not inform them that he was prescribing, he was giving the daughter cannabis oil. But the doctors were definitely amazed, and written in her medical report that the tumor has shrunk, and she's getting better. So from this point of view, doctor, I'm sure you yourself have seen many miracles that medicinal cannabis could provide for what they call patients who really need it. So do you have any examples that you might want to speak of, Dato? Maybe. Yeah.
I do have a few. I mean, I've seen they have a lot of improvement. For instance, I've got a patient who has multiple sclerosis. Is wheelchair bound, can't really walk, and short distance, can't really walk and go out and do things because of the condition. But after trying the oil, she slowly is able to start again ability to mobilize and walk, and now she's actually able to go around to do her activities that she otherwise would not be able to. This is after using the oil for probably about 6 months. I've got a patient as well who has a muscle spasm called Huntington's chorea. So he is an elderly, about 70 years old, in a nursing home because of the Huntington condition, and has involuntary movements all the time, shaking of the limb, pulling and looking. And she can't really rest or sleep because of all these involuntary movements. After trying on an oil that has combination of a CBD and a THC combination, we did have to try 2 to 3 different ratios initially before we get to the right ratio. And then now he doesn't have this involuntary movements anymore. The nurses at the nursing home were very amazed at the improvement of this patient. The family were very happy. He was able to vocalize and start interacting with the family again. Because with that Huntington's chorea, initially before we started, he was not able to vocalize and interact with the family. So there are a lot of good improvements with medicinal cannabis. Obviously, it's not 100% for everybody. Some people may not have improvement at all. But generally, majority of them do have some sort of improvement, especially with chronic pain. Some of them have good improvement, ranges from about 50%, 80%, even almost completely gone in terms of pain that has been debilitating the activity of daily living, reducing the quality of life. So we have seen a lot of improvement for a lot of patients.
Okay, Dato. Thank you very much, Dato, for your insights. Dato, I have another question. My fourth question would be, in your opinion, how could we educate the doctors here in Malaysia? Because I'm sure in Australia you had a grace period where the doctors were able to adapt to the changes in law. The TGA, when it was introduced, I'm sure many doctors were given training, more education about how cannabis is used on the homeostasis of the endocannabinoid system. In your opinion, doctor, in Malaysia, what is the best way for the government and the people to educate doctors about
I guess in Australia wise, we had workshops or seminars by people who have been prescribing it for a bit longer, especially when it first started in 2016. There are various training organizations, NGOs, training organizations that are advocating for the use of medicinal cannabis. So they held seminars for the patients. They also held the seminars for GPs, for instance, people or doctors who are interested to learn more about prescribing and how to prescribe and what the dosage titration, and sort of to hold their hands as well in terms of helping and guide them, to give them the confidence to prescribe them, and also to remove that stigma that is still in some of these GPs as well, that when prescribing something I'm not quite familiar with, I'm not quite sure, they're afraid that the patient may have the psychosis or the psychoactive component because of that THC component in there. So we have workshop and seminar that way. Some of the brands have approached me to look into mentorship, as in for someone who obviously have done a lot of prescription, I can then mentor someone who is new or who has only prescribed to a few of their patients, but they want someone who they can bounce ideas with in terms of medical colleague to medical colleague, in terms of having tech conferences or discussion about this person who has this patient with this type of condition have tried these various medications. What are the types that we're looking at using? What can we do? Or what do we do? How do we increase the dose? If there are any side effects to be expected, or if there is a side effect, how do we manage that? How do we titrate the doses so that it gives them the benefit in terms of improvement? So we have things like that in place. So I would assume that something similar in Malaysia would be good to educate the doctors there and also to guide them as well in terms of how to prescribe. It's the same as any other medication, I guess, in a way. When you have a new medication that came out, obviously education about how to use it, how much to use, what are the contraindications, or what are indications we're using them. So it would be something similar to that, I would believe, in order to educate the medical profession there, in terms of if they were to prescribe that and how does it happen or how does it work in that sense.
Okay, Dato. Thank you very much, Dato. Dato, actually, we would love to hear more from you in the future if we do have a chance to get on call again, or even through seminars or something like that. Because in Malaysia right now, I'm sure many doctors are also wondering where they can learn more about medicinal cannabis, and I'm sure there's a lot of universities, especially in Australia. If I'm not mistaken, ACU has opened up for medicinal cannabis research and
the clinical trials and research.
Yes. So it's a great advancement that we are seeing all over the world, which we are very happy and proud to see, Doctor. Especially having someone like you, Dato, who's prescribing medicinal cannabis in Australia, who's well versed with how the medicinal effects of cannabis is, and how patients react to it. So, Doctor, Dato, sorry, if before we end our session today, I think I would like to ask you, is there any message you would like to leave Malaysians who are viewing today, all the viewers at home? Is there anything you would like to say?
I would say open up your mind. Don't have that stigma of growing up with it being a dangerous substance or illegal substance, without the judgment or block use, or opening up to see the perspective of what the medicinal cannabis can do. I mean, of course, as with anything, there is a double-edged sword. You can have the good use of it, for instance, medicines to use for improving certain conditions for patients. But of course, if someone who will misuse it, then you will create issues as well. So open up your mindset to be able to open up and see what are the good of the medicinal cannabis. What does it do for certain patients? A lot of patients end up going to it not because they want to, but because they really try other medications and they're not working. The improvement is reducing, not improving their quality of life. So it is something that we can use for the betterment or improvement of conditions, so that patients don't have to suffer as much from the ailments and the conditions. So definitely open up your mind, be open-minded about it. Don't let the stigma stop you from looking further into it. It is definitely something that I hope that the Malaysian government can look into, creating, legalizing. But of course, legalize it, have a framework, that you have access to it through the proper channels, so that we can stop the use of medicine cannabis from the illegal black market, where we do not know what's happening, what's in there. So at least you can have it properly controlled by the medical profession there, and guided by the medical profession to guide the patient and educate the patient on how to use it properly.
Okay, thank you very much, Dato. I think we had a lot of very useful and very enlightening insights from you today. I really appreciate your time for being with us, Dato. Before we end the session today, again, I would like to say thank you. Thank you for being with us today.
No problem.
So for those of you guys who are at home, who are viewing the show today, if you have any questions, please drop it at the comment section below, and we'll get back to you as soon as possible. And of course, stay tuned for the next episode of Canna Tell You Something to find out more about what cannabis is. So thank you very much, guys, and I'll see you guys in the next episode. Take care.